Greetings everyone. The following video will thoroughly explain the organ known as the pancreas, from its function and structure to its history. We eagerly hope it will be of your enjoyment and that it will inform you successfully. Thank you.
The pancreas is a very important organ which is formed around the 5th week of gestation. Its formation starts as two separate parts, the ventral and the dorsal pancreas, but they later fuse. Around the 13th and 16th weeks, the pancreas is a very important organ which is formed around the pancreas is a very important organ which is formed on the 5th week of gestation. Its formation starts as two separate parts, the dorsal and ventral pancreas, but they later fuse. Around the 13th and 16th weeks, the pancreas starts secreting substances.
The pancreas is an organ found in the upper left side of the abdominal cavity. It is surrounded by the small intestine, the liver, and the spleen. It can be found between the stomach and the spine. The best plane in order to view the internal structure of this organ is the frontal plane.
The pancreas is about 12 to 15 centimeters long in the average human body, with its weight between 60 and 100 grams. The pancreas is formed of 5 parts: the uncinate, the body, the tail, the head, and the neck. It is mainly composed of both epithelial endocrine tissue and epithelial exocrine tissue, one in charge of secreting digestive juices into the small intestine and the other of secreting insulin directly into the bloodstream.
The main functions of the pancreas include the ability to produce chemicals that properly digest food. With the secretion of several enzymes that break down food into molecules, the food is later absorbed by the intestines. The secretion of insulin is also made by the pancreas, which is triggered in response to a growth in blood sugar levels. It moves glucose from the blood into muscles and other tissues, and aids in the liver's absorption of glucose, storing it as glycogen.
There are some pancreatic diseases that can be very dangerous if not treated correctly. The ones that we're going to focus on are chronic pancreatitis and type 2 diabetes. Type 2 diabetes. Diabetes occurs when a person does not have enough insulin to process the high amount of glucose or sugar in the blood. From all the types of diabetes, the type 2 diabetes is the most common. The person does not produce enough insulin, and unfortunately it usually gets worse. Obesity is not a cause of diabetes, but it is a very important factor. To both control and to prevent the disease, a healthy lifestyle is very important. You must eat fruits, vegetables, high amounts of fiber, avoid saturated fats, and obviously control the amount of sugar you consume.
Chronic pancreatitis is an inflammatory disease that results in the irreversible deterioration of exocrine and endocrine function. It is caused by alcoholism. The effects of chronic pancreatitis include nutrients maldigestion and malabsorption, problems with the absorption of calcium and therefore the bones, flatulence, failure to maintain, gain weight, nausea, abdominal pain, lower deficiency prevalence for vitamin A and vitamin E. Ways to prevent it include low consumption of alcohol and regular checkups.
As you can see, prevention from these diseases isn't very different from having a healthy lifestyle. Also, there are nutrients which are especially helpful to the pancreas as well as other parts of the body. These nutrients are vitamin B and iron. Vitamin B is responsible for the correct functioning of the nervous and immune system, and cell growth and division, healthy skin and muscle. Iron, on the other hand, is responsible mainly for the production of hemoglobin. Both can be found on fish, beans, green leafy varieties of vegetables, and lentils, between others.
Prior to the scientific revolution, the pancreas was discovered by Herophilus, a Greek anatomist and surgeon. Its name came from Rufus, in the 1st or 2nd century AD. Written in Greek, it meant all flesh. Hundreds of years later, Galen was the first person who classified the pancreas as a cushion to protect the blood vessels. Because his words were taken as true without a doubt, it stopped research on the pancreas for several years. Finally, thanks to Andreas Vesalius and his work, to fully understand the human anatomy, research on the pancreas started again.
Although the advances in medicine during the Industrial Revolution were few, important discoveries were done during this time. Around the 700s and 1800s, Thomas Coley found a relationship between diabetes and the pancreas, and someone introduced the term abdominal salivary gland to the pancreas, which is a reference to the salivary glands in the mouth and which secrete saliva.
The period between 1800s and 1850s was a difficult one for Mexico. There was the War for Independence, a civil war, and external issues such as the French intervention. All this made it difficult for Mexico to achieve any significant scientific advance, but this did not mean that there wasn't any work done in the science and medical fields. In Mexico, the most studied issues were related to diseases rather than to organs or their functions. They were interested in the workings of different infections and how they may affect indigenous people. They were also concerned about public health and diseases that could cause epidemics, such as cholera. An example of this is the creation of the Consejo Superior de Salubridad.
In some of the most recent advances, there is a study made by Drs. Jaffe and Lajeru, which created a vaccine for pancreatic cancer. This vaccine works by using some cancer cells that will not harm the body and which were modified to secrete GM-CSF, a molecule that acts as a lure to attract immune system cells from the vaccine. The vaccine is still being tested, but results from a trial in 2005 shows promising results for these vaccines. We can also see a study which uses many of the studies from many years, since 1973, and which showed that as a result that there is a correlation between diabetes and pancreatic cancer. There is an increased risk of having pancreatic cancer for a patient diagnosed with diabetes and a great probability of having pancreatic cancer if a patient has diabetes.
This is it for the video. Without further ado, we hope you enjoyed it and that it successfully informed you about the pancreas. Thank you for your attention.